Hello there, this is Mustafa Abdurrabbu, consultant of cardiology from Cairo. Today we'll discuss the diagnosis and the echocardiographic findings of left atrial myxoma with a focus on echocardiographic findings. So, this is a 70-year-old female patient who presented to us with progressive exertional shortness of breath and occasional syncope. Her history started few months ago and it is of gradually progressive character. Her cardiac examination on referral showed no significant findings, so we proceeded with echo. This is her parasternal long axis view, and it showed normal LV contractility, normal dimensions. However, there is suspicious mass seen prolapsing through and moving freely across the mitral valve. Do you know what is this? Yes, this is what we call myxoma. However, it sometimes have different manifestations and different hemodynamic impact in every patient. Do you see this aliasing? This myxoma is causing some sort of mitral stenosis. As you can see, there is an aliasing in the forward flow of the diastolic flow across the mitral valve. After seeing the parasternal short axis view at the level of the mitral valve, we can see that there is temporary prolapse of the myxoma across the mitral valve. The prolapse of the myxoma across the mitral valve is probably the reason why the patient gets dyspnea by causing mitral stenosis and the syncope when it completely obstructs the flow. So we shifted to the apical 4 chamber. The apical 4 chamber adds that it showed that the mass is attached to the interatrial septum, which is typical for left atrial myxoma. It also gives us an idea about the surface. It is not shaggy. There is no significant areas of necrosis, and there are no areas that are prone for embolization. So it is more or less a benign in origin tumor. As you can see, the aliasing is seen in the forward flow, and on continuous wave Doppler we can appreciate a gradient of 7.2 millimeter. This can increase in the case of exercise when the patient is doing her ordinary activities, what gives her dyspnea. Finally, you should continue your study, try to measure it in multiple planes and take your remaining views. This is the apical 3 chambers, or between apical 2 and 3 chambers. There are no regional motion abnormalities. So our final conclusion is a mass in the left atrium, probably myxoma origin. However, the remaining chambers are of normal dimensions and function. There is no significant valve lesions apart from the obstruction at the level of the mitral valve because of the myxoma. We also include the dimensions in the report. However, we know that the dimensions are not usually that accurate, and we usually go for cardiac MRI or go for surgical removal and pathological confirmation of the diagnosis. So here are few important things to remember about myxoma. It is the commonest benign tumor of the heart. 75% is found in the left atrium. However, it is not exclusive to the left atrium. The most site of origin is the interatrial septum. This is true for left atrium myxoma or right atrial myxoma. Early surgical intervention is usually indicated, as with increase in size, patient can get syncope, and with much increase, this can lead to sudden cardiac death or can lead to significant injuries. So as soon as you get a myxoma on the diagnosis, you usually go call your surgeon and tell him that we have a patient with myxoma, we need to intervene as soon as possible. It usually presents with exertional dyspnea. However, syncope and embolization can occur. In cardiac examination, you can hear a tumor block, or you can hear a murmur suggestive of mitral stenosis. The echo is usually confirmative. MRI can be helpful. However, the final diagnosis comes from the surgical evacuation. The important thing to remember that it can present as familial condition, and it can present as part of multiple endocrine neoplasia, what we call Carney complex. So you should screen carefully using history. If the patient have history of other tumors, if the patient is having family history for tumors in the mother, in the sisters, and so on. In the end, thank you for watching this case. We hope that you help us by sharing, subscribing, and liking our content. Feel free to contact us if you have any questions. That's it.